Have you ever paid one price for a refill and then the next month a totally different price? Prescription prices can feel unpredictable. One month a refill can cost $15, the next month is $90 with no clear reason why. But here's the secret, most people have more control than they think. In this module, you'll learn the proven ways to save on prescription by using tools, asking the right questions, and navigating the system the way healthcare insiders do. You'll walk away knowing how to find the lowest price, use your insurance wisely, and connect to programs that keep your costs down, all without cutting corners on your care. All right, for this agenda, for this module, we'll start with the pharmacy. Prices aren't the same everywhere. Ask about 90-day supplies and mail order options. Use discounts, coupons, and assistant programs. Next, work with your provider to lower costs. Use your insurance benefits strategically. Stack your savings, combining tools and programs. Troubleshooting common insurance and pharmacy issues, advanced saving tips for everyday patients, key takeaway, and closing and next step. Do you check more than one pharmacy before you fill, or do you just go to the closest one? What if a 2-minute search could cut your costs by half? Start with the pharmacy. Prices aren't the same everywhere. Pharmacy prices work more like airline tickets than grocery stores. They change based on contracts, volume, and timing. The same medication could cost $8 at one pharmacy and $40 at another. Step 1. Compare before you fill. Use free price comparison tools such as GoodRx, SingleCare, ScriptSave, WellRx, or Blink Health. Type your medication name and dosage, and you'll see prices at nearby pharmacies. Sometimes a smaller pharmacy or warehouse club beats big chains. 2. Ask if cash is cheaper. Believe it or not, paying cash can occasionally be cheaper than your insurance, especially for low-cost generics. Ask the pharmacy to check both prices before running the insurance claim. If the cash price is lower, you can choose to pay it directly. Paying cash usually will not count towards your insurance deductible, so use this option mainly for inexpensive drugs. Step 3. Stick to one pharmacy for safety. While comparing prices saves money, try to keep all your active prescriptions at one main pharmacy once you decide. That lets pharmacists monitor for interactions and maintain a complete record of your medications. You can still shop around again later if big price difference appears. Now here's an example. Tanya discovered her antibiotics was $27 at her local pharmacy chain, but only $8 at a grocery store pharmacy a mile away. She switched for that fill, then moved all her future prescriptions there so her records can stay consistent. If you're on a stable daily med, would you rather pay one copay or 3? How much time and money would a 90-day rhythm save you this year? Ask about 90-day supplies and mail order options. Insurance companies and PBMs often reward consistency. If you take a medication long term, such as for blood pressure, cholesterol, or thyroid, filling a 90-day supply can lower both cost and hassle. Now, why 90-day fills save money? Plans frequently charge one copay for 90 days instead of 3 monthly copays. That's a 66% saving over time, plus fewer trips to the pharmacy. Mail order pharmacy. Mail order services connect to your plan can ship a 90-day supply directly to your home. They work best for stable, ongoing prescriptions that don't need frequent dose changes. Now, here's a pro tip. Always verify the mail order pharmacy is in network before ordering. Using an out-of-network mail service can erase your savings. Also, order refills early. Delivery can take 7 to 10 days. Before paying, do you ever ask, is there a coupon, a card, or program that lowers this? Use discounts, coupons, and assistant programs. You don't have to choose between affordability and quality. Several legitimate programs can reduce what you pay beyond what your insurance covers. 1. Discount card and apps. GoodRx, Single Care, and ScriptSave generate digital coupons accepted at most pharmacies. They apply at checkout and show the discounted price immediately. You don't need to sign up for credit cards or membership. Simply present the coupon. Now, you can't combine these discounts with your insurance claim. You must choose one method per fill. 2. Manufacturer savings card. Brand name manufacturers often publish copay cards on their website under patient savings or support programs. These reduce your copay sometimes to a little as $0 for people with commercial non-government insurance. They don't work with Medicare, Medicaid, or TRICARE due to federal rules. 3. Patient assistant programs, PAPs. If you're uninsured or have limited income, many drug companies and nonprofits provide free or deeply discounted medications. You need to fill out a short form and show proof of income. Some clinics and social services office can help with applications. 4. Community and state resources. Check your local health departments, federally qualified health centers, and nonprofit groups. They often hold free drug disposal days, offer discount vouchers, or link residents to PAPs. Now, here's an example. Carlos lost his job and insurance. His diabetes medication cost $400 a month. His doctor's office helped him apply to the manufacturer PAPs, and he received his medication at no cost for 12 months. What's one question you'll bring to your next visit? Generic options, pill splitting, or covered alternatives? If the price is a barrier, what would make the same treatment affordable? Work with your provider to lower costs. Doctors and prescribers understand that medication costs affects adherence, and they want to help you find affordable options. Now, start the conversation. Say something simple like, are there any lower cost or generic options for this treatment? Could we use a higher dose that I can safely split in half? These are normal questions. Many pills are scored for safety splitting, but some aren't, so providers must first confirm. When appropriate, tablet splitting can cut costs almost in half. Ask about therapeutic alternative. If a drug isn't covered or requires prior authorization, ask if another medication in the same class is covered. Your provider can check the plan's formulary or send a note to justify the exception. And lastly, request fewer trips. If you have multiple refills, ask for a 90-day supply authorization so you can combine them through mail order or single pickup. Now, here's an example. Angela's asthma inhaler costs $75 each month. Her provider switched her to a comparable medication on Tier 1 for $15, saving $720 a year. Do you know your plan's preferred pharmacies and the tiers of each of your meds? If a drug jumps tiers in January, what's your plan B? Use your insurance benefits strategically. Your insurance plan isn't just a payment system, it's a map. Learn how to navigate its details give you leverage. Preferred pharmacies. Most plans have a preferred network. Using these pharmacies give you the lowest copay because they're agreed to reduce rates. Check your plan's website or app for its preferred list. Know your formulary. The formulary lists the drugs the plan covers, and their cost tier. Review it at least once a year. Changes can happen every January. If your medication moved to a higher tier, ask about covered alternatives before refill time. Generic incentives. Some plans reward you for choosing generics with lower copays or rebate programs. Ask member services if this applies to your plan. Appeals and authorizations. If your medication is denied or priced too high, you can appeal. Your provider can send medical justification through prior authorization process. Once approved, the plan covers the medication at the appropriate tier. Now, as of this recording under federal law, all health plans must provide a formal appeals process and given a written decision, usually within 30 days for non-urgent prescriptions. Which two savings steps could you stack today? Formulary, check plus coupon, or mail order and PAP? What would it take to bring your monthly cost to zero? Stacking your savings, combining tools and programs. Real savings come from combining strategies like checking your formulary, ensures coverage, compare cash prices, reveal cheaper pharmacy options, add in manufacturer coupons, lower brand copays, use mail orders or 90-day refills, reduces repeated copays, apply for assistance, covers what's left. Now, here's an example. Nora used a brand arthritis drug that costs $450 a month. She uses the plan's preferred mail order pharmacy, saving $60. Applies the manufacturer copay card, saving $300. And uses a state arthritis foundation grant for the remaining $90. By stacking the programs, her total dropped from $450 to $0. When something goes wrong at the counter, do you know the exact questions that unlocks the fix? Which of these issues have you hit before? Higher prices, coupon failures, or denial codes? Troubleshooting common insurance and pharmacy issues. Issue number one, the pharmacy charged more than I expected. Ask for the claim detail printout showing the allowed amount, the planned payment, and your copay. If it looks off, call your insurer's member services number. Usually, the pharmacy system hasn't updated the newest prices. 2. A coupon wouldn't go through. Check that the coupon matches exactly with the medication strength and form. You can't use a coupon and the insurance on the same transaction. Ask the pharmacy to return the claim as cash for the coupon. Issue 3. My medication was denied. Ask the pharmacist for the rejection code, like prior authorization required. Call your provider's office and give them that code so they can submit the right prior authorization form. Keep copies of your responses for records. 4. I need help paying while I wait for approval. Ask your doctor if they have samples. Check the manufacturer's website for bridge supply programs. Many provide a free 30-day fill while paperwork is processed. Now, pharmacy benefit managers must provide electronic rejection codes. Which small tweak would have saved you most this month? Combo pill, store promotion, health savings account, flexible spending account, or switching plans at open enrollment? What's one habit you can automate? Advanced saving tips for everyday patients. Even small adjustments can add up to hundreds per year. Number 1, ask about combination therapy savings. If you take 2 separate pills, ask for a single combination pill exists. It may cost 1 copay instead of 2. 2. Shop during pharmacy promotions. Some chains run seasonal promotions such as gift cards or store credits for transferring prescriptions. Always verify safety. No duplicate fills before moving prescriptions. 3. Use your health savings account or flexible spending account wisely. These accounts let you pay for prescriptions, tax-free. Keep all pharmacy receipts in case your administrator requests proof. 4. Split maintenance meds between spouses' plans. If you and your spouse each have insurance, compare coverage. Sometimes one plan's formulary has cheaper tiers for certain drugs. 5. Revisit your plan each year. When open enrollment arrives, review each plan's drug benefit. A plan with slightly higher premiums can still save you money if it covers your medication at lower tiers. If you could only do two things next month to cut your costs, which one would you pick? How would you track what works so you can repeat it? Key takeaways. Let's put everything together. Pharmacy prices vary. Always compare before filling. 90-day supplies and mail orders save money and time. Discount apps, coupons, and assistant programs cut costs immediately. Providers can adjust prescriptions to fit your budget safely. Insurance plan rewards informed members. Know your network and formulary. Combine strategies for maximum savings. Formulary plus discount plus mail order equals real options. Now, here's an example. By checking our formulary, comparing GoodRx prices, and switching to mail order, Kim reduced her annual medication cost from $1,200 to $360 without changing her treatment. Medication costs don't have to control your health decisions. When you know how pharmacy, insurers, and assistant programs connect, you can manage your prescriptions confidently and keep both your treatment and your budget on track. What will you set up today? A price check habit, a 90-day refill, or an assistant application? Which step would make the biggest difference for your budget this quarter? Closing in next module. Medication costs shouldn't catch you by surprise. Once you understand how each part of the system fits together, you can make choices that work for you, not against you. In the final module, we'll bring everything together with how to stay safe and organized with your medication, tracking refills, managing your list, and communicating with providers to avoid confusions and mistakes. I will see you in the next module. Thanks for watching.